Making the right Medicare decisions is very, very critical. The problem is sometimes people do not know everything they need to know to make those right decisions. So in this video, I'm going to share with you 7 very important details that no one is telling you about Medicare. Detail number 1. Taking Parts A and B at 65. We're all eligible for Medicare at 65 as long as we have paid into the Medicare tax system. But do we have to take Medicare at 65? Well, it just depends upon your situation. So if you are still working and covered by a plan at work, or your spouse has you covered by a work plan, and that group has at least 20 employees, that company has 20 employees or more, you don't have to do anything with Medicare, not A or not B. Now, most people are told they got to at least take Part A, and that is not true. If the group is 20 or more, you don't have to do anything with Medicare whatsoever. Now, you can enroll into A only if you would like to, and when that happens, Medicare is going to pay second and your group plan is going to pay first. But remember this, if you do enroll in A only and you're contributing to an HSA, you have to stop contributing to the HSA if you take Medicare Part A or B. And so if someone has an HSA, what I would do, I wouldn't take A or B. I would just simply stay on the group plan. All right. And so that's those of you that are still working in groups of 20 or more. Now, it could be that you're still working, but you have a group plan that has 19 or less. You actually have to enroll in A and B. You have to. And the reason for that is because once you're Medicare eligible, that group plan no longer has to pay first. It actually becomes the secondary payer, so you have to enroll into Medicare to put Medicare in that first payer position. Now, what most people do when they're in these small group plans, 19 or less employees at the company, what they'll do is they'll actually drop the group plan, enroll in A and B, and then either get a supplemental plan or a Medicare Advantage plan. That typically works out best for their scenario. But if it's 19 or less, you've got to enroll into Medicare. Now, let's say you're no longer working. So this means that you're retired. You are on an ACA plan, Affordable Care Act plan, one you got through the exchange, or maybe you're on COBRA insurance, right? In these kind of instances here where you're no longer working, ACA plans or COBRA, you have to go on Medicare A and B. And you need to do that at 65. We call this your initial enrollment period, which only lasts for 7 months. And that initial enrollment period is 3 months before you turn 65, the month you turn 65, and then 3 months after that. So you must enroll into Medicare at 65. Now, if you're on Social Security, you'll be automatically enrolled into Medicare A and B. But if you're not on Social Security yet, you're going to have to initiate the enrollment, and you have 7 months to do that. And the month you enroll will determine when they start your coverage. All right? So does everyone have to take Part A and B? Not necessarily. It depends upon that work situation. That brings us to detail number 2, the importance of 40 quarters. If you're working for someone right now, what is happening is 6.20% of every dollar you're making is going into Social Security. 1.45% is going into Medicare. We call these FICA taxes or payroll taxes. So all of us, through our work, are funding Medicare and Social Security. In order to draw benefits from these systems at the appropriate time, we have to have at least 40 quarters, right? Now, this is actually 10 years worth of work. And so as long as you have worked for at least 10 years, paid into the Medicare tax system, then you're going to be eligible to draw Medicare benefits. Now, there are sometimes people have not worked 10 years, and then the way that works is if they're eligible, they'll be able to draw from someone else's work record, which would be what? If you're married, presently, as long as your marriage has lasted 1 year or more, you can actually draw those Medicare benefits off that spouse. As long as that spouse is at least 62 years old, you can draw from them. Now, if you have an ex-spouse, the way that works is this. As long as you were married 10 years or more, and you did not remarry prior to the age of 60, you can actually draw benefits from that ex-spouse. Now, if you remarried prior to the age of 60, you cannot go back to the ex-spouse. So if we remarry after, we certainly can do that. Now, if that second marriage ends in death or divorce, then you have the right to go back to the ex-spouse. So again, if you don't have 40 quarters, you can get it from the ex-spouse. Now, there are some times that people are married and their spouse dies. So you also can get benefits off of a deceased spouse as long as your marriage lasted at least 9 months and you didn't remarry prior to the age of 60, you can draw benefits from the deceased spouse. All right? And so we have to have 40 quarters to be eligible for Medicare Parts A and Part B. And if we don't, if we can't get it from someone else, then we have to buy Medicare Part A, and it's very expensive. Part B, of course, is as well. So that's the importance of the 40 quarters. Hey, just real quick, we often hear from our viewers that they wish that they would have seen a video earlier because they made a decision that really wasn't in their best interest, or they made a decision without having this information and it cost them financially. And we don't want that to happen to you. We upload 3 times every week, and the only way you're going to know about our new videos is if you subscribe to the channel and hit the bell notification. We're constantly giving away brand new strategies, updates, and comparisons that you don't want to miss. So click the subscribe button below this video right now and turn on notifications so that you never miss another video. Detail number 3 is the real cost of Medicare Part B. Now, for most people, as long as they have 40 quarters, Part A will have 0 premium for the rest of your life. But the Part B premium, we're actually eligible for Part B because of 40 quarters, but it is not going to be free for anyone unless you have 100% Medicaid coverage, and that means low income and low assets. They don't have to pay for Part B. But the majority of people are not on Medicaid, and so you're going to have to pay for Part B. And so when we talk about Part B, and again, I'm talking about 2023 premiums, most people pay $164.90 a month for their Part B premium. Okay, now what happens is if I'm on Social Security, that Part B premium comes right out of my Social Security check. Now, if I'm on Medicare, but I'm not yet taking Social Security, because remember, you can be on Medicare without taking Social Security. In fact, some people delay Social Security to age 70, but we're eligible for Medicare at 65 as long as we have those 40 quarters. All right, but the point is we have this Part B premium that's monthly. And so if I'm on Social Security, it comes out of my check. I have no choice about that. But if not, I can set up a couple different ways to pay for this. And one is called Medicare Easy Pay. So if you would like to do some kind of a bank draft, then Medicare has this system called Easy Pay, where you can actually have the government go into your checking account once a month and they usually draft around the 20th of the month. Or what you can do, you can actually set up what's called a MyMedicare.gov account. MyMedicare.gov account, and you can go online and you can actually pay your Part B premiums that way. And the other way you can do it is actually a direct bill. So my whole point is we're going to have to pay for Part B. A lot of people think Medicare is going to be free, and it's not. And so this comes out of Social Security. If I'm not on Social Security, then it's Easy Pay, Medicare.gov, or they'll send you a direct bill on a quarterly basis. Now, I want to explain how this Part B premium is calculated. We're eligible because of 40 quarters, but our exact premium is going to be based upon what we call your modified adjusted gross income. That's the adjusted gross income. And by the way, if I'm going on 2023, they're going to look back at 2021. If I'm Medicare in 2024, they're going to look back at 2022. They always look back 2 years, and they're looking back at modified adjusted gross. So we have our adjusted gross income, and they modified by adding back in any tax-exempt or tax-free interest income. That amount is actually above the AGI line, but they put the two together. So when someone invests in municipal bonds, possibly some U.S. savings bonds, maybe income they earn out of the country, that income is not taxable, but we still have to report that on our tax return. And so adjusted gross plus the tax-exempt interest or tax-exempt income. They always look back 2 years. So this number determines our Part B premium. So here's what happens. They set a threshold every year, and again, I'm talking about 2023 thresholds. So if you are a single filer, filing an individual return, and your income, modified adjusted gross, is $97,000 or less, this is what you're going to pay on a monthly basis. If you're married, you file a joint return. So here we have married. So we have a couple, right? And that number is $194,000 or less. Again, we pay the $164.90. Comes out of our check, or they're going to bill us quarterly, or we'll set up some kind of a bank draft. All right. So depending on where you're single or married will determine what that amount is going to be. Now, for those of you watching this that are going to be above those thresholds, what you're going to be dealing with is a thing that we call an IRMA. An IRMA. And this IRMA is an acronym which stands for Income-Related Monthly Adjusted Amount. So if I'm above $97,000 as a single, above $194,000 as a couple, then we're going to pay additional amounts. And there's 5 different levels of IRMAs, but you're going to pay more, anywhere from an extra $75 a month upwards to about $500 a month, depending upon your income. And again, this will all be established every year as Medicare looks back 2 years from your tax return to determine what you are going to actually pay for your Part B premium. All right, the fourth detail that's crucial to understand is what's called their Medigap open enrollment period. Medigap is also a Medicare supplemental plan. Those are synonymous. And so many people think that when they go on Medicare, they can make decisions just whenever they want. They can enroll in a plan whenever they want. And that's not the way it works. For every plan that's available, there will be rules. And this one is a critical rule. So let me just give you a quick example. Let's just say that someone's going to start Medicare at 65, and let's say their birthday is July 15th, 1958. Okay, they're turning 65, and they're no longer working. They're going to go on Medicare. So what's going to happen is they're going to have an A date of 7/1/2023. They're going to have a B date of 7/1/2023. So when we talk about this Medigap open enrollment period, what this means, this Medigap open enrollment period is always tied to the B date. So when someone starts A only and then they retire later and pick up B, then it's going to be tied to the B date. So Medigap open enrollment's tied to the B date, and it lasts for 6 months. And so here's what happens. This Medigap open enrollment period gives someone 6 months where they are in what we call a guaranteed issue period. Guaranteed issue. That means if they decide to get a supplemental plan, there's 10 different options. Most people today are either getting an F plan, a G plan, or an N plan. Those are the top 3 plans right now. But if I get one of these supplemental plans, I have the 6 months where the insurance company has to issue the policy regardless of any health questions, regardless of serious pre-existing conditions. They will absolutely issue that policy 6 months of the B date. Now, in the real world, what happens? We actually can apply 3 to 6 months for insurance before we start our B, but the Medigap open enrollment period is going to last for this 6 months. Okay, so in my example, July 1, here's what's going to happen. All of July, August, September, October, November, December, I am in that Medigap open enrollment period, which would mean then January 1, the next year, 2024, moving forward, if I want to get a supplemental plan now, I'm out of my open enrollment period, and now I'm going to have to medically qualify to get that policy. And now there are 4 states where there's an exception, which would be Washington, Connecticut, Vermont, and New York. Those states you can get one anytime, but all the other 46 states, after you go beyond that 6 months, if you want to get a supplemental plan or change supplemental plans, you are going to be subject to underwriting, which means health conditions matter, medications matter, pre-existing conditions matter, and those insurance companies do not have to issue that policy. But during these 6 months here, they have to issue. It's law. It's just the risk they take when they do business in any state. During those 6 month window, you can have any policy, any company that you choose. That brings us to the 5th detail that I think is important for you to know. Now, you'll learn that as you go on Medicare, there's 2 options for using your Medicare insurance benefits. One is you can stay in A and B of original Medicare and get a Medigap policy to fill in the gaps that Medicare did not cover. And then with that, we also add a drug plan. That's one option. Half of all people do that. The other option, you can get an Advantage plan. These are called C plans or replacement plans. This is a Medicare alternative. And so people enroll in these plans, and now they have a private health insurance company that's replacing original Medicare. So when you go on Medicare, it's one or the other. You cannot be on both, and you have to decide which is going to be best for you. Now, what happens is there's a lot of ads about Advantage plans. They talk about the perks that are offered that original Medicare doesn't offer, and also there's usually very low premiums to the insurance company, which sometimes make it very attractive to people. Now, they're not free as far as your healthcare services. You're going to pay copays for sure, but they have a 0 premium. So again, that's attractive. And so companies promote these because companies make more money on Advantage plans. There's a lot of ads about these, and certainly agents promote those as well because they frankly pay higher commissions. But what they don't talk about is the dark side. They don't want you to know about this because if they did, fewer people would enroll in them. So I'm going to talk about just the dark side. And I'm not saying that Advantage plans are bad. They're not bad. But there are some aspects to Advantage plans that are not discussed that you need to be aware of so that if you select one of these, you'll not be surprised when you find out about it. So number 1 is this. When you're on an Advantage plan, you are absolutely going to be on a network plan. And network plans are HMOs and PPOs. all right? And so that just simply means that this private health insurance company has put together a network of doctors and hospitals and other providers that will provide this care to you. And the HMO's smaller network, PPO's a little larger network, but if I compare that to staying in original Medicare A and B with the supplemental plan, it's unlimited, because if I have a supplemental plan, I can go to any provider that takes Medicare, because Medicare supplemental plans and A and B do not have a network. Their only requirement is they have to take Medicare. And so 99% of all doctors do, almost all hospitals do. So it's almost unlimited when you have a supplemental plan, but not so whenever you have an Advantage plan. There will be a network, and with that comes less providers, some limitations, certainly different restrictions, all right? So that's the dark side. Number two, and this is a big one, and that is what's called a pre-authorization. Pre-authorization. When you sign up for an Advantage plan, what you'll learn is that about 70, they say right now, that about 72% of the healthcare services that you will need for your healthcare is going to have to be pre-approved by the insurance company. Now listen, you do not have to have a pre-authorization to go see your primary care doctor, to see a specialist, to get labs and preventive work. Those don't require pre-authorization. But what will require pre-authorization would be an MRI, a CAT scan, a PET scan, an inpatient stay, inpatient surgery, outpatient surgery, a knee replacement, a hip replacement. Really, folks, anything that's going to be more on the expensive side will require pre-authorization. Here's what that means. That means the doctor says you need this hip or knee replacement or surgery, whatever, and they say you need it. And if you're on an Advantage plan, it's going to have to be pre-approved, though, by the insurance company before it's covered. So they submit paperwork, and there's going to be someone in the home office of that insurance company that has to agree with the doctor's assessment and approve that. And sometimes they do immediately, and sometimes they don't. Sometimes it's 2 or 3 weeks or 6 weeks before they would approve it. Sometimes they flat out deny it. They say, no, we don't believe you need that knee replacement. We believe injections in your knee would be sufficient, or rehab would be sufficient instead of getting a hip replacement. So there are times it's delayed, there's sometimes it's denied. And so if you're on an Advantage plan, you have to live with that. As we compare that again to A and B with the supplemental plan, you never have pre-authorizations. The insurance companies have no say-so whatsoever. With an Advantage plan, they actually have the final say-so. But with the supplemental plan, they have no say-so, because if Medicare says we'll cover it, doctor says you need it, end of story. Insurance company has no say-so. If Medicare pays, they have to pay based upon the med sup that you purchased. All right? And so again, pre-authorizations, that's the dark side. And then lastly, and this is rarely talked about, and that's this, permanent. If you take an Advantage plan and you stay on that plan, let's say in any time over a year, and sometimes even less, but a year, 2, 3, 4, 5 years, you decide that you no longer want to be on your Advantage plan and you would like to switch to one of those Medigap policies, one of those Medicare supplemental policies, in order to make that switch. If you've been on that Advantage plan any length of time, now you're going to have to medically qualify to make the switch. In other words, you have to go through a process, and those insurance companies that offer supplemental plans don't have to take you. You're outside of your guaranteed issue right. And so they're going to ask you 25 or 30 health questions, check all your medications, get a statement from your doctor to see what your general condition is. And so now, when that information is submitted to the insurance company, if they don't like your pre-existing conditions, they don't like some of the medications you're taking, they can deny that application and you will not get that supplemental plan. So there are people who get on a Medicare Advantage plan, everything is fine, they're healthy, then their health changes, they've been on it a while, and now they have to be on the Advantage plan for the rest of their life because they have AFib, or now they are insulin-dependent diabetic that has complications. Maybe they have rheumatoid arthritis or osteoporosis or some kind of health issue where that insurance company says, nah, we're not going to approve that application. All right? And so that's the 3 dark sides of the Advantage plans that you must be aware of.
Hey, if you're looking for someone to help you hold your hand through this entire Medicare enrollment process, we would love to do that. Our team is standing by to help you. We help about 1,000 people a month go from Medicare confusion to having their plans enrolled, and it takes probably less than an hour. Go to the pinned comment below and you can book your appointment.
Now, detail number 6 is the most important decision that surrounds a Medigap policy, or when you select a Medicare supplemental plan. What's the most important part of that? Well, a lot of times people think the most important thing is the initial premium. In other words, what's that insurance going to charge me on a monthly basis for that plan? Now, by the way, that is important, but it is not the most important thing. What is the most important thing is the stability of the rates. And fortunately, what happens is a company like ours, we actually track stability stability of rates. So when we talk about carriers, yes, we care about the initial rate. That's what you're going to pay when you first go on that plan, but all rates are going to go up. Everything goes up in the Medicare world because of medical inflation. So what I care about is, what do I think those rates are going to look like in 3 years or 5 years or 10 years down the road? Initial premium is not everything. It's the stability of the rates. And so that's why we like national carriers, a carrier that has larger groups, a carrier that has more of a larger market share. Why? Because then the larger the group we have, the more rate stable that's going to be. So what happens, we have some companies that are more regional, smaller groups, and we have some companies that are much larger. All right? So most companies take increases because that group is losing money, and the state insurance commissioner will approve a rate increase if that block of business, that group, is losing money. And so if I have a small block that has a lot of health problems in it, well, that's going to have some fairly drastic and probably very frequent price increases. But if I have a larger block and we have some health issues, that risk, again, is going to be spread out to more people. Kind of a silly illustration, but I think it makes my point. And that is, if you're in a small block of business, a small group, more of a regional carrier that doesn't really have a good market share, it's kind of like being in an ocean in a canoe. A large body of water, and you're in this small canoe, and you're going to feel the impact of all those waves. But if I'm in that same ocean and I'm in a cruise ship, you probably won't hardly even feel the waves. They're there, but there's less impact. So all prices are going to go up. That's going to happen, but smaller companies and smaller groups are going to tend to see more drastic and more frequent price increases. And so that's what I'm saying. Initial premium is not everything. The stability of the rate. So we can look back at all these companies and say, how stable have they been the last 10 years? And probably history will repeat itself. So we like to go with companies that are, yes, good initial rates, but also stable for the long haul. All right, that brings us to the final detail, and that is why you need a Part D plan. Now, Part D plans are for our prescriptions that we self-administer. Medicare A and B will cover meds that we take that are professionally administered in hospitals and outpatient facilities and clinics and doctors' offices. But anything we're going to self-administer, this is when we have to have a Part D plan. Now, let me explain. If you decide to get a Med Sup plan, right, you will add a prescription drug plan to that coverage. Could be a different company, could be the same company, but there's going to be a different policy and a different premium, and those can be changed on an annual basis. If you decide to go with the Medicare Advantage plan, what happens is they will include in that plan a prescription drug plan. So they actually select a plan for you. Here, you can kind of pick and choose what you want based upon the meds you take and the pharmacy that you want to go to. But we're going to need a drug plan. Now, here's the temptation. Sometimes people are healthy and they say, well, I don't take any medications. Well, the problem is you're looking at today. What about in 3 months or 6 months? You need an expensive medication. I regularly have people that are clients that are taking meds that are $7,000 a month. Had one the other day, it was $23,000 a month. So again, we don't get a drug plan because of what we're taking now. We get a drug plan because of what we may need in the future. And some meds are very, very expensive. So we always get a Part D plan. And if I'm going to do a supplemental plan, you can get Part D plans for right now anywhere from $7 to $10 a month. And they'd be adequate. So if I get an Advantage plan, they're going to include that. But the reason it's important is because you don't know what you're going to need. And they say right now the most money we are spending in healthcare expenses is on medications. And so again, we don't think now, we got to think into the future. And if we don't get a drug plan, when we're first going on Medicare, either at 65 or when you retire, what happens is there will be drug plan penalties. 1% for every month that you go without a prescription drug plan, and those penalties are for life, okay? So we get it just in case we need it, something that's expensive. And by the way, you can continue to use your GoodRx coupons and pay cash for some of your meds. But I can assure you, if you get a real expensive med, those GoodRx coupons are not going to provide much help for you. That's why you want a prescription drug plan. You'll pay a fraction of the cost if you're going to be on expensive meds, and will avoid all the penalties. So everyone needs a prescription drug plan. Get one that's embedded, or just get a standalone drug plan that's very low cost. And then the good thing is you can change those on an annual basis. If your meds go up or your meds go down, you can simply switch your plans.